Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Hello everyone, I am Dr. Rohit Goyal. I am ENT specialist, ear, nose, throat specialist. I am working in RG Hospital. It's situated in the Bathinda, Punjab. From last 15 years, I am working as a consultant here. It's a pure ENT hospital. Now, the topic for today is common myths about vertigo and misconceptions. To start with the biggest misconception of vertigo, vertigo is not same as general dizziness. So in medical terms, vertigo means false sensation of movement, usually spinning, tilting, or shifting when you're actually still, because how you describe your symptoms is better to how you diagnose. It will depends upon the I feel dizzy is vague, but saying I feel spinning, I roll over in the bed can immediately point towards BPPV, which is the most common vestibular cause of a vertigo. This is like it's the most common term in vertigo is BPPV. Full form is benign paroxysmal positional vertigo. When patient says, when I move my head in a particular position, either right or left, I feel vertigo, which lasts for not more than 3-5 seconds. When I change my position, my vertigo goes. This is the most common cause of vertigo, which generally occurs in older people, and it can be diagnosed very easily because it occurs in particular position and its name is BPPV. Another one is vertigo of heights. Fear of height is called acrophobia. Vertigo, on the other hand, is a medical symptom little to balance system dysfunction. The confusion comes from everyday language, but medically, these are completely different terms. What BPPV is the most common, it can be treated by some maneuver, by repositioning maneuvers. It's called Epley's maneuver, vestibular rehabilitation exercises, which is very, very important. We can treat the vertigo with particular exercises. Generally, vertigo, like when people come after 5 days or 10 days in OPD after having medicine, they say, Doctor, we have got a little improvement. One thing is very, very clear. Vertigo will last for around 5, 10, 15 days and it recovers very, very slowly. The brain adapts to vestibular problems through movements and recalibration. Avoiding movement for too long prevents this adaptation. That's why vestibular rehabilitation works. Another myth is that vertigo sometimes seriously with the brain. The fear is very, very common. When people come on the vertigo, they say, Doctor, like we have got something that dysfunction in the brain. Generally, vertigo, which has normal test, there is no problem. Some vertigo are vestibular migraine, episodic condition like BPPV or menial disease, which generally get vertigo. So, if we have been listening as a patient, caregiver, clinician, in this series, we will help you about the how to treat the vertigo. Main thing vertigo is vestibular rehabilitation exercise. Avoid the condition which causes vertigo, proper medicine which lasts for around 2 to 3 weeks. Thank you.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.